As healthcare professionals and people who function in today's world, we are immersed in technology. It is ubiquitous. From the time we get up in the morning till the time we retire to sleep at night, we interact with and have technology constantly around us. We have smartphones, we have smartwatches, we have Fitbits and other devices that, even while we're sleeping, can be taking measurements of physiologic functions and storing that data so that we can later interpret it as useful information. Hi, I'm Sal Sanders, and we're going to be talking a little bit about visualizing data, databases, and data considerations. So let's get on with it. As respiratory care professionals, you're dealing with the future of healthcare. This presentation by Health IT was designed to promote the electronic health record and get information out there about it. And it was done a few years back. So I'd like you to take a view of it, see what you think, because now you're actually living that future today. You're interacting with the electronic health records. You're working with physicians and other healthcare professionals who are also obtaining data and information that's been processed from the electronic health record. The electronic health record as a system is going to, I think, revolutionize patient care and greatly improve health for all of us. Enterprise resource planning, or ERP systems, are used to facilitate the flow of information, to allow opportunity for data-driven decision-making within healthcare institutions, within educational institutions. Just about every major corporation probably utilizes an enterprise resource planning system, or ERP, in order to allow managers and clients and people to interact and to facilitate this exchange of information so that, again, data-driven decisions can be made. Oracle, PeopleSoft, here at the university we have a system called Banner that we use with the student records and billing and to generate grade cards and all that great information. We really don't have cards anymore, but great information, and provide lots and lots of reports, including the enrollment of classes, and provide a lot of useful information that can be provided to various constituents so that data-driven decisions are made. And the same types of systems are in place at the hospitals, where you can not only look at medical information, patient records, see images of x-rays, but also systems that will also take into account for billing and patient stay and how many people had breakfast delivered and all those sorts of things. When you think about it, a hospital or a healthcare setting is kind of like running a small city. And so there's lots of need for information in a very timely fashion, and ERP systems can help to facilitate that, provide reports, data that can be visualized, and lots of information so that good decisions can be made to help the organization achieve its goals, its objectives, so that it steers towards its vision. Bootstraw and Govers, in their article, Understanding ERP System Implementation in a Hospital by Analyzing Stakeholders, suggest that ERP systems require significant organizational and technical considerations, and there will be changes. These changes will affect stakeholders who have the varying perspectives and interests in the system. In healthcare systems, this is especially the case, as the units who are responsible for delivering services are accustomed to functioning autonomously. And so many times as you implement an ERP system or a CRM type system, you're going to have some changes that are going to be due to the implementation of that system. So some changes are going to affect stakeholders in the way that they work, in the way that they interact, and perhaps even some of the operational aspects of how they conduct their day-to-day operations. So just something to be. This figure illustrates the model, which is informed by processual, interpretive, and integrationist models of change. These models emphasize that various groups of people and organizations may interpret information systems differently, and that these interpretations may influence their actions and affect the implementation and the development of the enterprise resource planning system. And you'll see this as you take a look at almost any type of implementation of technology. The way people perceive things, the way they interpret information systems can definitely influence their actions, and it can affect the implementation of the system itself. Because we not only interact with those computer systems, but we also have some influence on them, especially in the way that we choose to utilize things, the way we choose to procedurally develop systems, and the way we choose to interpret that information that comes back from those systems. It's important to understand stakeholders when implementing a system, such as any enterprise resource planning system. And the purpose of their paper is to develop a theoretically based model to analyze how stakeholder attitudes and behaviors in a hospital setting affect the outcome of enterprise resource planning implementation. So this is a really good article to read, written back in 2009, but still very applicable. And in their article, they suggest that even after implementation, the head of the medical staff believes that their involvement would have remained minimal had management done their job correctly. So one of the quotes there, because they failed, we were forced to save the hospital. Enterprise resource planning systems are quite common, and this graphic depicts some of the different areas that need to be taken into consideration when you're implementing an ERP, and some of the areas that are going to be affected by implementation of such a system. And you can see human resources, financials, manufacturing, supply chain management, customer management, data warehouse, projects. It encompasses every major aspect of the institution, of the business. And two very common ERP systems, Microsoft Dynamics and Oracle, and there are others. In the article by Cash and others, is there an app for that? Electronic health records and a new environment of conflict prevention and resolution. The electronic health records are ushering in a new environment of conflict prevention and resolution. The stimulus bill brought forward by the Obama administration, the government has provided more than $19 billion to encourage the adoption of information technologies, including electronic health records. Well, with the use of electronic health records, we're bound to have at least a little bit of conflict, problems, disputes, as we have access to more and more information, and there may be information that we're not typically used to seeing, and now we want to resolve some of these conflicts with the data that's being stored in these electronic records. So these new technologies, such as the electronic health record, have a great chance of enhancing patient empowerment as we truly become a partner with our physician in our own health care. But because of the access to lots more information, there's the potential there for conflicts and problems to arise. And again, this electronic health record is part of changes introduced as part of the American Recovery and Reinvestment Act. They proposed the adoption of online dispute resolution systems to help prevent and address problems that may arise in the context of the electronic health records. And these could be problems related to the amendment of digital records. kind of interesting. Stuff doesn't seem to go away once it's been stored, so we very well all may have an interest in having some amendments done to our digital electronic health record at some point in time. As we get into social media, we think of social media, it's a collection of web-based and mobile technologies that really come together to create true interactivity among users. Definitely a Web 2 technology. Users can create and consume content. When we think about social networking and social media, there's such great opportunities here. For very little money, you can create quite a presence. And I have a graphic here that shows the Youngstown State University College of Graduate Studies page on Facebook. And I encourage all of you to get on Facebook and like it. And but there's many, many social networking sites, Facebook being one of them, that's very widely used. And many of us use it not just for social interaction with family members, friends, other people that we care about, but also it can be very useful for customer relationship building, customer relationship management, financial management. There's just such great opportunities out there, and you really do need to be aware of your presence, your online presence, your social presence within these networking sites. Some others out there, of course, YouTube, Twitter, LinkedIn, lots of places for you to share your professional life. And there are probably close to 100 million users out there on some of these. I know that I have pretty active LinkedIn and Facebook accounts, and I use and I really do enjoy my existence on both. What about you? When we think of some of the social activities that we do online, utilizing various technologies, including our smartphones, standalone computers, we can engage in so many things today. It's truly, truly an Internet 2.0 type world. Shopping, playing games, learning things, including this online class. Different types of online role-playing games exist with just massive audiences. Also, massively open online courses. And I put a link in there for one of them. It's being offered by Microsoft. You can join up for free. I have no interest in this other than the fact that I think it's a really cool educational experience to be involved in one of these massively open online courses. And this one is free of charge from Microsoft, analyzing and visualizing data, pretty appropriate for this topic, right? With Excel. And so you can join up, develop your skills with Excel, and learn a few things. And if you want to have the credit towards it and become certified, I think there's like a small nominal charge. But it's free to take the course if all you want to do is learn for your own personal satisfaction, your own self-enrichment, if you will. When we think about databases and data warehouses, it's important that we realize that these are just everywhere. Many of the services that we access online all have information that they're gathering and storing, information about us that can be used to decide what types of products we like, what type of music and movies we like, what type of entertainment we prefer, and then personal characteristics about us. And they gather this information to be utilized to make data-driven decisions. So when you have an analytics-driven organization, databases and data warehouses are important. When you think about iTunes, it was launched in 2001, and such an impact that it's had on the way that we entertain ourselves, or the entertainment that we enjoy, I should say. When you think about music today and movies today, you can download nearly anything in a digital format and take it just about anywhere you want to go. The library has been transformed. Paper books, of course, still exist, and you can still get books on tape and books on CD at the library, but you can also, in many public libraries, including the one here in Mahoning County, download audiobooks, narrated books, if you will, and enjoy them anywhere you want to go with your smartphone or an MP3 player. Newspapers, photos, and other information all available online. Again, in many cases, to access this information or this content, the digital content that's available there, you have to create an account, and that can be used to store information so that, again, an analytic-driven organization can make use of that to help better serve their customers, but also to help accomplish the goals of the institution, of the business. Business intelligence is the resource component of the overall framework or the field of analytics. Business intelligence is collective information about customers, competitors, partners that your business might have, the competitive environment that business operates in, as well as internal operations. And this collective information gives leaders, managers, if you will, the ability to make effective, important, strategic business decisions. So analytics is the science of fact-based decision making, and business intelligence is the collective information that allows for good data-driven decisions to be made. As healthcare practitioners, you know the importance of data security, of keeping information private. You're aware of HIPAA laws. Very important who has access, and only the people who should have access to the information should have access to it. But also a big consideration when you're looking at database and information that needs to be shared is that people who should have access to it need to be able to access it. They need to have access to that information. And so important considerations when you're implementing databases and these different types of business decision systems is not only who has access, but how do they have access to it. Can you access it remotely? Do you have to be on site, on the campus in order to utilize the system, or can you access it remotely? All of these different decisions have risks and benefits, right? You know, it's a lot easier to secure something if you have to physically be in the same location in order to utilize it. It's a little more vulnerable when you can access it from halfway around the world at any given time of day. So there's a lot of decisions to be made, but these decisions these different aspects have to be considered if we're to truly be able to provide some semblance of security for the data and the systems that are key to our business. And as we keep talking about making these, data-driven decisions, you can imagine how important data and these technology systems are to the business. At least here at the university, in many ways, if our network goes down, our student information systems don't work, if I can't get access to our CRM system to approve students and see who's coming in, wanting to get into the college or graduate studies, in some ways I may as well go home. There's not a lot that I can do without access to the computer systems. And while we're talking about data, this important piece, data encryption is very important if we want to keep data away from prying eyes, so that even if someone does manage to hack in, or pick up your thumb drive that has a bunch of files on it, if the data is encrypted, it may be very difficult for them to gain access, at least any meaningful access to what's on the system or on that drive. So data encryption is a very big part of keeping things secure and private, as well as data anonymity. Now, data anonymity is very good for, this is where you scrub the identifiers off the data so that you have the data. The data are there, but they're not linked to any personal identifiers. This is very good for research purposes, but it doesn't make a whole lot of sense, at least as far as a usability would be concerned. There's not a lot of usability of the data when you're working in a day-to-day healthcare institution, because you do have to know whose blood pressure that is, and it's very important that that data be linked to the particular patient or patients that we're working with. So data anonymity's got pretty limited use as a security measure in the day-to-day operations of a healthcare institution. This graphic was generated by Recruiter. This is the College of Graduate Studies CRM. This is a customer relations management system that we implemented to manage and analyze interactions and information and data to improve relationships with our students, our customers, so to speak. And this has been very, very useful for us. Students have the convenience of applying online, and then the faculty can review the files. You know, there's a lot of steps to getting into the graduate college, as you're well aware. Submitting transcripts, letters of references, lots of different things. Sometimes you have to write a personal statement or a vision statement of what you want to do with the degree, these types of things. All this information gets collected and then can be looked at by people to make sure that the files are complete, and then the files can be sent off, if you will, to reviewers within the various programs. They can take a look at that data and again make data-driven decisions and make recommendations so that the student can be accepted. That information all comes back to the College of Graduate Studies, where I get to actually make admission decisions. And all this information can be communicated in an automated fashion back to applicants to let them know that they have, in fact, been accepted to the College of Graduate Studies. So there's a lot of really great communication systems built into the system, as well as the ability to look at data, to analyze it, put it into context, and have useful information. An example of visualizing data, your text does a good job of describing the importance of being able to visualize data. But in a graph like this, you can see this is our admissions funnel, and we have to work with a lot of students to bring students actually to Youngstown State, then get them to make a decision and get the department to decide to accept them into the program, get them actually admitted, and then eventually to actually get them enrolled in classes. And it's commonly thought of as a funnel, and this system tracks an awful lot of information. So we can track everything from when a person first hears about Youngstown State University, or they make an inquiry about a program, or say, hey, I'd like to know more about YSU, to when they actually start their application. You can see the number goes down a little bit again, and then do they actually apply? So right now, this is a graphic from a future term. Enrollment's not even open yet, so you can see that the very tip of the funnel, where we want to get people enrolled in the classes and confirmed, is down to 0. And then, we go from applications started, 140. Now that'll continue to change as people complete their application that they started. So they become an applicant. Right now, that's cut in half at 70. And then actually admitted from this same group of folks, down to 4. So we're doing a lot of work to bring in, have the potential of bringing in 4 new students. It's a great business, and this type of system can really help us to fine-tune our recruiting and marketing efforts, and it also can provide a great service to our students and our applicants, as they can get a lot of really quick and useful information. As they submit each different piece of information, the system can send them out an email saying, hey, you sent in your letters of reference, but you still need to send in this personal statement of what you want to do with the degree. So there's a lot of exchange of information. It enhances communication and also provides a lot of really useful data to make, again, data-driven decisions. On this slide, just a few terms. Database is a collection of information organized and accessed according to a logical structure of that information. A relational database uses a series of logically related two-dimensional tables or files to store information in the form of a database. Relational database is a lot more useful than a flat database. And data dictionary contains the logical structure of the information, and this plays a big role in making sure that your data stay consistent, and provides a roadmap so that you can see how things are related. There's a primary key, and this key is the field or group of fields that uniquely identify a record. In some cases, like in student information systems, you might have a student ID number that each student is given, so that's unique to each student. You might have 10 students named Mary, hundreds of students with the last name of Smith, but each student would have a unique number so that you can always pull that unique student up, and so that other fields can be related to that uniquely identifying entity. Often a field or a group of fields that make sure that you have a unique identifier for a given record. Just a little bit on data hygiene, and data hygiene is a concept which really depicts the degree to which the database contains errors. We would like data to be error-free. We want the data in our database to be error-free. We would like it to be consistent so that it's always entered in the same type of a format. And just as an example, you could either enter chronic obstructive pulmonary disease or COPD. Well, depending on how that would be entered, if I'm searching for one or the other of those, I may not get the other group. So if I'm searching for COPD, I may not get chronic obstructive pulmonary disease patients. So you can see how data entry and data storage, the formats that things are stored in, can impact the usability of a database system. Same thing with formats for cities and states, phone numbers, and you see a lot of control measures being put in on the user input screens of these systems to try and control and maintain some semblance of data hygiene. Another aspect of this is how the system is designed and where data are stored, so that hopefully the city and state go to the same tables all the time and the same spots in the same tables. So there's a lot of things to consider to make sure that you maintain good hygiene of your data. Very important that we have consistency. If you think about medical records, if the address is entered incorrectly, billing could be impacted. Patients might not get notices and information that's being sent out to them. If data based on geographical location are used to track incidents of illness for reporting purposes, like epidemiological reports, some illnesses or conditions may be reached in error. So conclusions that are reached using this data might be incorrect. So very important to maintain good data hygiene as well as data security. You can see the importance of these ERP systems, these database-driven systems, customer relation management type systems. They can be very, very powerful for hospitals, for healthcare systems. The electronic medical record could revolutionize doctor-patient relationships. But all these things depend on a lot of functions. We need to make sure that they're well designed, that we take the stakeholders' input into consideration when putting them in place, that we look at the vision, the goals, the objectives of the hospitals and healthcare systems and institutions that are utilizing these systems to make sure that the systems are suitable for the business practices. Again, the goal is to have data-driven decisions made, and really this technology can be so useful in helping us to improve patient care and improving the health of the businesses and enterprises that utilize these systems. So very important. In order for that to happen, they have to be implemented properly. We have to have good data hygiene, and above all, well, maybe not above all, but at least in conjunction with all, we have to have good data security. We also have to have security that works so that the systems are still usable for the end users. Take good care. Bye.